So let me take this opportunity to welcome all the participants. I see more than 750 right now and still joining. This is the training program on leveraging South-South and triangular cooperation, inclusive and technological innovations for urban health and disaster risk reduction. This program is this set of three training programs is going to be presented in English. But at the same time, we also have simultaneous interpretation available in Arabic, Chinese, French, Portuguese, Russian, Spanish, and international sign language. So to choose the language that you need, just go to the globe sign at the bottom of the screen, and there you can choose the language. So this training program, of course, follows the prior training programs for many years, which have covered more than 9,800 participants from 155 countries. This training program this time for 2025 will be on the 12th, the 19th, and the 26th of March at the same time on each of these days. So you can see the time for New York and other Geneva, Bangkok, and other places. So please remember to log in on at the same time as today. And also remember that this is a certificate course, but to receive the certificate, you must attend all three sessions, and you must do the post-session survey. So please make sure you do that and use the QR code to access the course materials and all the session recordings and so on. But rest assured, once you sign in, the system automatically recognizes you, and it will track you for all the three sessions so that the certificate is issued. So please make sure that you attend all three sessions, but also do the evaluation. So with that, I think we can go into the session proper. Today we have a very interesting lineup of speakers with vast experience in the subject. But we also at the end have a quiz. So you will all be asked to participate in that quiz also just before the closing. So this session, the first one, which we are doing today, is about inclusion of persons with disabilities in disaster risk reduction. And it is being led by UNDRR. My name is Sanjaya Bhatia. I'm the head of the Global Education and Training Institute of UNDRR in Incheon, South Korea. And I welcome all of you again. We see now that there are 1,000 participants. So let us start first with the opening remarks. And to kick off this session, we have the chief from Pan American Health Organization and WHO, Piedad Huerta Arneros.
Distinguished colleagues from the United Nations Office for Disaster Risk Reduction and the United Nations Office for South-South Cooperation, esteemed participants across the world, it is my great pleasure to welcome you to this important capacity building program on leveraging South-South and triangular cooperation, inclusive and technological innovations for urban health and disaster risk reduction. This collaborative initiative between PAHO, the Office of Disaster Risk Reduction, and the Office for South-South Cooperation represents our shared commitment to building resilient health systems across the Americas and beyond. This is the fifth workshop we have organized throughout this productive interagency collaboration. The timing of this training could not be more critical. In recent years, our region has faced unprecedented challenges from disasters triggered by natural phenomena, diseases, and human-made hazards. The COVID-19 pandemic further highlighted how vulnerable our health systems can be, also exposed the disproportionate impact that emergencies and disasters have on people who are already vulnerable, particularly persons with disabilities and older adults. At PAHO, we have long recognized that disaster risk reduction must be inclusive and equitable. I am particularly proud of our pioneering work in addressing the specific needs of persons with disabilities during health emergencies and disasters. The Americas countries are implementing accessible early warning systems, inclusive evacuation protocols, and specialized training for health workers to provide appropriate assistance for persons with disabilities during disasters. We are intensifying our focus on older persons that are disproportionately affected by disasters due to a complex interplay of factors extending well beyond the health sector. Older adults often face high risks due to chronic health conditions, mobility limitations, sensory impairments, and social isolation. They may depend on medications, specialized care, or assistive devices that become inaccessible during emergencies. Our work must address these vulnerabilities with a truly multisectoral approach, bringing together health, social services, transportation, housing, communications, and emergency management, among others. This training program embodies the principles of the Sendai Framework for Disaster Risk Reduction, which explicitly calls for an inclusive approach that considers the needs of all populations and groups. Throughout South-South and triangular cooperation, we can share valuable lessons and innovative approaches that ensure no one is left behind when a disaster strikes. South-South and triangular cooperation constitutes a critical modality of technical cooperation to accelerate progress of the Sustainable Development Goals, as well as national development priorities, including health for all. Also contributes to promote collaboration among countries and the exchange of knowledge and experiences, as well as horizontal partnerships to address common health and development challenges through dynamic, flexible, and adaptable solutions. Solidarity, cooperation, and collaboration among countries facilitates experience and knowledge sharing and contributes to building up based on good practices and lessons learned for further strengthening national and local health capacities to be better prepared and efficiently respond to emergencies. Through the promotion of South-South cooperation, international organizations like PAHO and our partners can support countries and promote cooperation among them, convene policy dialogues, create new partnerships, mobilize additional resources, identify good practices, and existing capacities in member states, including technological innovation that can be shared and transferred among countries to reduce health inequalities. I am particularly encouraged by the diverse expertise gathered for this 3-week program. Each of you brings unique perspectives and experiences that will enrich our collective learning. I urge you to engage actively, share openly, and build connections that will extend beyond this training. Please consider how the knowledge gained here can be immediately applied in your own context and how we might collectively reimagine more resilient and inclusive healthy futures for all. I wish you a productive training. Thank you very much.
Thank you. And now let us move to the and hear from the next speaker, Dima Al-Khatib, Director of the UN Office for South-South Cooperation.
Dear participants from all around the world, welcome to the 5th annual certificate training on leveraging technological innovation for urban health disaster risk reduction and inclusive and resilient cities through South-South and Triangle cooperation. This training is jointly organized by the United Nations Office for South-South Cooperation with the UN Office for Disaster Risk Reduction, UNDRR, and the Pan-American Health Organization, PAHO, of the World Health Organization. Over the past 5 years, our joint efforts with UNDRR and PAHO WHO have been incredibly rewarding. The 4 previous training series have attracted over 16,000 live session participants and self-paced learners from some 155 countries and territories. And I'd like to thank UNDRR and PAHO colleagues for the 5 years of commitment, the collaboration, and the partnerships ever since the onset of the pandemic in 2020. Let me also take this opportunity to introduce to you the work of the United Nations Office for South-South Cooperation, UNOSSC, and the importance of this training today as an illustration of what we strive to achieve. UNOSSC is the United Nations focal entity for South-South and Triangle cooperation. South-South cooperation fosters collaboration among developing countries by facilitating knowledge exchange, technical cooperation, and resource sharing to achieve mutual development goals. Triangle cooperation brings in developed nations or multilateral organizations to support and facilitate South-South cooperation among developing countries to implement development initiatives. It enables Southern partners to access financial and technical support while allowing Northern partners to enhance aid impact. Since its establishment by the United Nations General Assembly in 1974, our office, the United Nations Office for South-South Cooperation, has been at the forefront of advocating and coordinating South-South and Triangle cooperation initiatives across the UN system and the member states. Our work encompasses facilitating intergovernmental and UN system processes, supporting developing countries, capacity development efforts such as this joint training, co-creating and sharing Southern-driven solutions and knowledge, and managing South-South and Triangle cooperation trust funds and global programs that translate our commitments into practical action. With today's event, we recognize the urgent need for inclusive, sustainable, and resilient urban environments. Cities are on the front line of global challenges, including climate change, health emergencies, and disaster risks. As urban populations grow, so does the need for innovative, technology-driven, and inclusive solutions that leave no one behind. And through this year training program, we aim to continue advocating for international frameworks like the Sendai Framework for Disaster Risk Reduction and the Paris Agreement on Climate Change, which offer clear roadmap for building resilient and inclusive urban spaces. We also aim to showcase developing countries and partners' good practices, experiences, and technological innovations, and promote the use of technologies, including remote sensing, artificial intelligence, and digital platforms for effective disaster risk management. Our collective ambition is to empower developing countries to exchange experiences, to co-develop adaptive technological solutions, and implement localized strategies that drive long-term resilience and sustainability. I'd like to take this opportunity and acknowledge that this joint training program is made possible thanks to the contribution and partnership of the government of China to the UN Fund for South-South Cooperation. We at UNOSSC and the government of China are also launching a joint program initiative entitled China-UN Global South-South Development Facility, dedicated to fostering practical cooperation among developing countries, scaling up impactful South-South and Triangle cooperation initiatives worldwide, and accelerating the progress towards the SDGs. I'd like to invite you to reach out to the office for information about our program initiatives and to explore concrete national and local South-South and Triangle cooperation project ideas through our knowledge and partnership platform, the South-South Galaxy. I'd like to also encourage you all to actively engage in discussions during the sessions today to share your insights and collaborate with your fellow participants. Together, through South-South and Triangle cooperation, we can drive meaningful change and build cities that are not only resilient and inclusive, but also future-ready. I wish you all an enriching and productive learning experience. Thank you.
Thank you so much. And to wrap up the opening session, let us now move to Kamal Kishore, the Special Representative of the UN Secretary General for Disaster Risk Reduction and the head of UNDRR.
Dear colleagues and distinguished participants, a very warm welcome to all of you. First and foremost, I would like to express my heartfelt gratitude to the UN Office for South-South Cooperation and the Pan American Health Organization for their collaborative efforts with UNDRR in organizing this important joint training session. Indeed, I am glad to see that this training, which started in 2020 in response to the COVID-19 pandemic, is still going strong today. This training demonstrates our joint commitment to applying the lessons of the pandemic, especially around the need to break silos and work across sectors to address complex risks. And to all the participants in attendance, I would like to commend you for undertaking this training. Our aim is to equip you with knowledge and practices that you can build on and tailor to your unique situations. And we hope you will not only apply what you learn here, but that you will also share it with your peers. Colleagues and friends, the growing complexity of risks and the cascading impacts of disasters across sectors demands that we adopt a multi-sectoral approach to resilience building. This need is most apparent in the context of addressing health-related disaster risks in urban settings. We saw this during the pandemic, and we are seeing it now with the growing problem of extreme heat, which has become a global challenge due to the climate crisis. And since disasters affect certain groups more than others, it is critical that we focus on enhancing inclusion in resilience building efforts to alleviate this disproportionate impact. That is the focus of this year's training, and why we have placed a special emphasis on the inclusion of persons with disabilities and older persons. Virtually every country is experiencing a growth in the number and proportion of older persons. And many older persons are also persons with disabilities, who are estimated to be 1/6 of the global population. Yet, as a global community, we are still far from fulfilling our commitments towards them. According to UNDRR's 2023 Global Survey on Disability and Disasters, 84% of persons with disabilities reported being unprepared for disasters, and 56% reported lacking access to disaster risk information. These figures highlight why we must urgently ensure the meaningful inclusion of persons with disabilities in disaster risk reduction planning. To that end, I would like to offer 3 recommendations for action. First, we must continue building the awareness and capacity of institutions and staff to address this problem. For our part, UNDRR remains committed to supporting capacity development and to fostering all of government and whole of society approaches to disaster risk reduction. Second, we must ensure that there are mechanisms to engage with at-risk groups and to capture their needs in planning processes. This is why UNDRR developed and piloted the Annex for the inclusion of persons with disabilities as part of our disaster resilience scorecard for cities. We invite all local governments to utilize this tested tool. Third, we need to promote international cooperation and the sharing of good practices among countries, especially South-South and triangular cooperation. By learning from each other, exchanging good practices, and working collaboratively, countries can accelerate the adoption of new solutions to ensure that no one is left behind. I would like to express again my appreciation to our interagency partners for co-organizing this training with us. And I thank all the participants for their commitment to disaster risk reduction. I encourage you to actively engage in this training, share your experiences, and take inspiration from the successes of others. Together, let us make our cities not just resilient for a few, but resilient for all. I wish you a successful training. Thank you.
Thank you so much. And now we have the opening session concluded. Now let me just go into the first session, which I am doing myself, which is the introduction to the concepts of disaster risk reduction and urban resilience and the MCR 2030. So for the next roughly 20 minutes or so, or I'll try to do it faster, I will present some concepts to you. But before that, let me just reiterate, because I see some questions for the certification. So for the certification, you need to do 2 things. One, attend all 3 sessions. So there are 3 sessions. Today is the first one. There are 2 more. You have to attend all 3. And the system automatically records that your attendance. That is one. Secondly, there is the post evaluation surveys. You have to do that also. So these 2 things you do, you will receive the certification. So now let me start my presentation. I think you can see the screen. Yeah. Okay. So let's start with the first concept that we hold very close, and that is disasters are not natural. So why we say that? That means basically what we are trying to say is that disasters happen by our actions. It's due to what we do, what we decide to do, that influences whether disaster happens or not. So if you see the upper photos, the upper pictures, those are barren areas. There is a landslide or an earthquake. It doesn't have any impact on us because there's nobody living there. And therefore, it doesn't impact us in any way. On the bottom left side picture, you see a situation of an earthquake. And again, here you see some buildings have collapsed, but some buildings seem to be untouched and even undamaged. So again, it's the choices we make, because in this case, you can make out that there are some buildings which probably did not follow the building code in their construction practice, whereas others did. And at the bottom right, you see a disaster waiting to happen. So these are informal settlements built on a slope. Next time there is an earthquake or heavy rainfall or a landslide, this will be, or even a fire, this will become a disaster. So it's all about what we decide to do. So we say that there are hazards around us all the time. So for example, in the room you said there is a fire hazard, and we are exposed to that hazard by virtue of sitting in the room. And we are vulnerable because fire is dangerous for human beings. But that doesn't mean there is a disaster. The disaster happens when all three factors, hazard, exposure, and vulnerability, all interact together, and that causes the disaster. So what we try to do is achieve resilience, and that we can do by taking various measures for mitigation. So in this case, we see that they have developed, they have established a retaining wall. So if there is a landslide or if that rock falls, the people and their home is protected. So you take measures. In the room that you are sitting, probably there is a smoke alarm, there is a fire alarm. Um, uh, if you're in an office building, there would also be sprinkler systems. So all of these are usual components of a building code, and they are all meant to mitigate against the hazard. So this is, again, it's up to us. It's our choices that we make. So it's very important that the decisions we take, they should be risk informed, meaning before we take any decision or we make any investment, we should do a risk analysis and make sure that the hazards that we find are mitigated against in the design of the project, the building, or the structure. As we go into the future, things are changing. One of the reasons is, of course, climate. The frequency and intensity of hydrometeorological disasters will increase. At the same time, there is a resource scarcity. There is a shortage of land, water, food all over the world. There is unchecked urbanization, which is putting a strain on the service delivery by local governments. And this leads to many people not getting the basic services, and this also increases their vulnerability. There are various governance challenges, conflicts, migrations, so on. There are many issues of inequality. So even this can be due to income, it can be a digital divide. All of these inequities, they enhance the vulnerability of people and increase the impact of disasters. And then the drivers of change, which could be poverty, could be lack of adequate nutrition, could be lack of education, lack of access to health services, and so on. All of these can also increase the vulnerability of people. So to try to find a way out, to find some solutions, all the countries got together in Sendai in 2015 and came up with the Sendai Framework for Disaster Risk Reduction, which is a 15-year voluntary agreement with 4 priorities of action and 7 targets. The targets you can see here, including to reduce mortality, reduce the number of affected people, reduce economic losses, and to reduce damage to infrastructure. At the same time, to increase the countries which have DRR strategies at the national and local level, to increase international cooperation, and to increase access to early warning systems. So these are the global targets, but apart from that, there are many other custom indicators and without targets, which countries can use to increase their resilience. And there are a number of tools available for local governments also, including through the MCR 2030. So the midterm review of the Sendai framework was held in 2023, and you can see here out of the 7 targets, out of the 7 global targets, only 2 are green, 2 are yellow, and 3 are red. And the red ones are the really critical ones, which is economic losses, number of people affected, and critical infrastructure and disruptions. So that means that a lot of work needs to be done, much more needs to be done. And that is part of the resolution, the political declaration at the midterm review. Now, as you know, there is a global initiative which we call the Making Cities Resilient 2030. This was launched in 2021 and goes all the way to 2030 till the end of the Sendai framework. But it doesn't come as a new project. This was the successor of the very successful Making Cities Resilient campaign, which also ran for 10 years, from 2010 to 2020. And that was more an advocacy campaign, whereas the MCR 2030 is looking more towards implementation, but also looking at advocacy. And to improve the implementation by local governments, the MCR 2030 provides a roadmap which divides the journey for resilience into 3 stages, stage A, B, and C. It provides a partnership. More than 380 partners right now are members of the MCR 2030. It has very strong regional links. So the implementation of the MCR 2030 is actually at the regional level, and there are regional governance structures also. It provides tools and methodologies and approaches from all of these partners, and these are all available on the MCR 2030 website, which is, you can see on the bottom, mcr2030.undrr.org. So have a look, go to that website, see all the tools there are there. And if you are from a city, think of joining, because joining is free and you get access to all of these structures. And plus you get access to the tools which can help you in the 3 stages. So these are what the 3 stages are: A, B, and C: knowing better, planning better, and implementing better. And there are different methodologies, different partners, and different approaches for all of these 3 stages. Then who is participating in the MCR 2030? So it's basically, we have the core partners, which are the big networks of local governments, such as UCLG, ICLE, Resilient Cities Network, World Council for City Data. Plus we have all the UN agencies and the World Bank and the Asian Development Bank, which are involved with urban resilience. There are, as I said, there is a regional governance mechanism, and there are regional entities there. And then there are a number of private sector entities, plus those from the universities around the world, which are, and also other cities who are trying to help each other. And also we have the national government agencies. So all of them are working to help cities achieve higher levels of resilience. And some of these cities are what we call resilience hubs. And they are cities who are trying to help other cities. These are cities which have faced the challenges of resilience building and risk reduction, and are now sharing those lessons with others. The MCR 2030, all the tools are based on what we call the 10 essentials. So these are, you can think of them as 10 sections or 10 chapters. These are the different activities or tasks or responsibilities that a local government has. So essential one, for example, is about organizing. So it's about governance. Essential two is about the assessments of risks. Three is about strengthening finance access. Four is about urban design. Fifth is about nature-based solutions. Sixth is about institutional capacity. Seventh is the societal capacity. Eight is for the infrastructure. 9 is about response, and 10 is about recovery and build back better. So you can see that these can easily be divided amongst the different departments of any standard local government. As I mentioned, there are a lot of tools here. I'm just mentioning the tools which have been developed through a process, a multi-stakeholder process facilitated by UNDRR. But with the technical support of a large number of other partners, including ACOM, IBM, World Food Organization, World Health Organization, Food and Agriculture Organization, IOM, CAF, and other partners. So these are tools which we call the scorecard. There is the preliminary and the detailed scorecards, but there are also others for public health, for food, for climate, for early warning, for displacement, for gender, and most important, with the one that we are talking about today, the inclusion of persons with disability. So with that, I will end my session here. All these presentations will be placed on the link which was shown to you earlier, and I think my colleagues will share with you again in the chat and before the close today. So the session materials, but also all the recordings of these sessions will also be shared with all of you so that you can keep them, and you are free to use them as you want. But whenever you use these slides, please make sure to give the acknowledgement from where you got these slides. So with that, again, I thank you. And I think I can maybe look at a few questions from the Q&A, because I think we have about 2 or 3 minutes. So there is a question about towards resilience. Can adaptation measures also be considered? So yes, definitely. Adaptation and DRR are quite similar in nature. So adaptation measures are definitely part of DRR. So if a local government, for example, develops a DRR strategy or a DRR action plan, there would be many measures in that which would be similar to adaptation measures. There's another question: how much humans are responsible for creating disasters, and how much do you agree? Yes, definitely. We are responsible for the disasters that happen. It is our choices. It is our laws, our regulations, our policies. So we need to look at what we are doing. And as I said, we need to try to also do a risk assessment. It doesn't have to be a big, very expensive risk assessment. There are many easy to use tools available freely online. So do a risk assessment and then try to take some mitigation measures. There is another question on rural areas and wildfire. So how to pause that. So, well, wildfire management is a very technical methodology, and usually the Forest Service knows how to do that because it requires some management. It requires burning controlled fires to get rid of the undergrowth. Also, it requires a amount of orientation or awareness generation amongst the people, because otherwise they do not understand what are the problems if this wildfire management is not done. How to get funds for projects? So to get funds for projects, basically what the donor is looking for, and this will be the last question I do now, what the donor is looking for is a well-articulated plan, which is reasoned, which is logical, in which thought has gone into. So if you are using tools, I showed you some of the tools promoted by the MCR, but there are others. But I talked about the scorecard. There is the city resilience profiling tool, city profile tool. There are other tools. If you use many of these tools, and these are all freely downloadable, freely available, to develop a plan, they help you to identify gaps and develop a plan. And when you have this plan ready, and that is the first step towards trying to develop a bankable project which you can access finance. So with this, I will end this part, and let me now invite our next speaker, Mr. Carlos Kaiser Mancilla, who is the executive director of ONG Inclusiva, and he will be talking for the next 10 minutes about disability inclusive disaster risk reduction. So Carlos, the screen is yours.
Hello. Can you see me?
Yes, you are clear.
Yeah, I have some problems with my screen. Give me just a few seconds.
We can see you. Yeah.
Stupid. I cannot see my screen. I'm having a technical problem here.
Or maybe you go into view and put in gallery view, so then you'll be able to see.
I'm okay now. Well, let's start it. The thing is that when we are talking about disabilities and disaster risk reduction, we are just talking about a very specific and problematic issue. We have great concerns about what's happening with people with disabilities all around the world. As you can see, we are a big number of the population. 16% of the global population corresponds to people with disabilities. That's to say that for every 5% that are facing a disaster, one of them is a person with disabilities. It's a huge number. But when we are trying to focus what's happening with people with disabilities, we would say that we have from 2 to 4 times more possibilities to die or to get injured during a disaster. It's a great, great number. We need to decrease this. We need to decrease this big issue that's happening with people with disabilities. It happened because I'm going to say something that is not nice. Society nowadays is or correspond to ableism. And ableism is something that is against what happened with people with disabilities, because it's the belief that we are inferior beings, that we don't have rights, or that the governments are just spending money, wasting money when they are spent helping us. That's a big problem, because when you have this mentality, you just are saying that people with disabilities are inferior, or not only inferior, are not desirable. So if they don't want us, they are not going to help us. It's what happened when we faced COVID 19, we remember that many hospitals didn't want to treat us. So it happened that they let us die. It's not nice. So we have more possibilities of dying and we have less social participation. We have to face it. People with disabilities are facing tremendous gaps into participation in the world. We are not having those help. We are not having the meaningful participation. We have a motto that is nothing about us without us. But nowadays, I'm afraid that probably we are saying that with no meaningful participation, we have no possibilities of changing what's happening. There are some tools that we're using. I have the opportunity of being the creator and also I was the consultant that helped to create the disability scorecard for Resilient Cities campaign. And let me tell you that it's a huge step because working with local government is part of the solution. It's not the whole thing we need, but it's very important to have it. So when we have this instrument, we say that the instrument with all the indicators shows that we can use applied knowledge in order to achieve inclusion. With knowledge, inclusion comes. If not, without knowledge, we cannot have this working properly. So that's what we need: applied knowledge and meaningful participation. When we talk about the disability scorecard applied to cities, well, we're saying that we can change things in the very city where people live, in the very community. It's a very important thing to establish that community-based solutions are stronger, and we need this strength in order to make the change possible. So when we are saying that people with disabilities face tremendous possibilities of dying 2 to 4 times more than the regular population, we're saying that this happened because of the barriers. We have environmental barriers, we have attitude barriers, we have also barriers that came from the buildings themselves. We have barriers that came from the communications. We have different kind of barriers. So when we decrease the barriers and increase facilitators, we ensure meaningful participation. With no adaptations, we have no inclusion. That's important thing to say. So as some people say that there's no natural disaster, what we have been creating is the conditions that make those disasters happen. It's not nature working against us. It's us working against us. It's us discriminating people. It's, we are the ones that are saying that we are leaving some people behind. And that's what we need to change. So we need that kind of knowledge. That's power to change, power to make things better, to improve things, to let people have meaningful participation, and also to establish networks that work towards inclusion. I believe that it's the time for questions. So I'm going to answer any question, but prior to answering the question, I want to say something.
Yeah,
we need
there are some
strongly,
questions which I can read out, but please go ahead, and then after that,
we strongly need to increase participation of people with disabilities. That's the message. So now I'm here to answer your questions.
So thank you, Kaiser. So one question is, which disability is the most difficult or challenging one to address and most discriminated upon in urban setting areas during a disaster?
There's no ranking of disabilities in order to say that's harder to work with. All disabilities have their issues. For instance, you have people that need, for instance, deaf people need sign language interpreters. And sometimes in many countries, during emergencies, there is no sign language interpreter. Also, we would say that people with physical disabilities would need physical accommodations to change, to be accessible, and sometimes we don't have it. So we can also talk about people, for instance, blind people, people with any other disability. So we would not say that there's a harder one, but we would say that all of us, all of people with disabilities, what we need is that there are some corrections that have to be made in order to achieve inclusion. And without those activities, those things, it's impossible. So that's what we need to change and to destroy the barriers.
Thank you. Another question is how to involve people with disabilities in community-based solutions in order to adapt to climate change, for example, in a coastal settlement.
It's a very important question. When we are talking about local level, we need to address the local organizations from people with disabilities. We need to talk with them and also to look for the local leaders, people with disabilities that are working on this. So we need to establish networks with them to share knowledge, to conduct trainings together, and also to make this network work with the local government. It's very important to involve the local government into this. If not, we are going to just have words, not actions. So that's important. That's why it's very important to have this in the local level.
Thank you. Another question is what national experiences, national or local experiences can be considered good practice in terms of inclusion of persons with disabilities in the disaster context? So could you just refer to one or two examples of good practice?
Yeah, I have some examples. I remember that Bangladesh used to have a very good stand-up for people with disabilities in the national level. They used to have a very good system. I don't know if they continue with it, but I remember that there was a lot of work with including people with disabilities into disaster risk reduction. And also in the local government section, I would say that we have a very good initiative in Pudahuel in Chile. As a matter of fact, I read that it's Maria Elena Opaso is going to be here in this training session. But it's good to say that they were the first city, the first district in the world to use the disability scorecard for resilient cities. It's very useful and powerful experience. I believe that they are going to explain it more in more details. But what I want to say is that those are two good examples. Also in Bangladesh, we have the Dhaka Declaration that was created as an initiative to promote what's happening around the world.
Thank you. Another question is when designing early warning systems, how can we ensure that the system is inclusive and responds to the needs of persons with disabilities? Should they be engaged during the design stage?
Well, this question is very interesting. It's a very interesting one because they said something that into the question that is remarkable. We need people with disabilities being part in the design of the system. Without having people working into the design stage, we are not going to have a good product. We need them to test it, or also to say which part is strong and which part is weak. Also, what we need is to have accessibility. With no accessibility, there's no inclusion. So with this accessibility in mind, we need this to happen, to change the thing, to have it into a very cohesive system. If not, it's not going to be a very good early warning system.
True. Yes, thank you for that. And then there is another question asking if there are any laws, if you know of any laws that are in place that mandate the inclusion of persons with disability in the disaster preparedness planning process. So, do you know of any laws or any example that anyone could adapt or adopt? And then how effective have these been?
Well, laws stating this clearly, no. I have no knowledge of one of them. But I know some laws in different countries that you can interpret them and to say that they force the government to be inclusive. I would say what happened in Chile. In Chile, we have a law that creates the national system for disaster risk reduction and prevention. So we have this law. This law is not stating clearly in any point that is for people with disabilities or that they have an adaptation for people with disabilities. But at the same time, we have other laws. For instance, we have Chile signed the Convention on the Rights of People with Disabilities. So we have to apply Article 11. It happened with several countries that they have it. So if you have the Article 11, you are supposed to adapt what you have for people to be with disabilities to get protection and participation during disaster risk reduction. So other things that we have the anti-discrimination law. This law means that you cannot discriminate a person because of his or her disability into other factors. So what happened is that if you took those different laws and you combine it all together, you have a significant body of laws that you can use in order to work with people with disabilities. The problem is that sometimes governments are so slow to implement those laws, and sometimes we have to argue with them. Sometimes we have to fight, and sometimes I believe that there's no political will to implement those things the way it should be. We don't have to beg for something that is a right. And what's happening is that we are begging for our rights, and that's not good. So I make a call for the different governments to get it quicker, be faster. We needed this to happen now because we are risking lives. And that's the thing I want to say.
Thank you so much, Carlos. We are now completing this session and moving to the next one, which is building up on the foundations that you have made right now. So a discussion on applying the scorecard for inclusion of persons with disabilities. So now I hand over to my colleague Mai to introduce the scorecard and some and the applications. Over.
Thank you, Sanjay. Let me try to put the presentation. I hope you can see the screen well.
Yes. We can.
So just in thank you. So just in connection to the now knowing a bit of the disaster risk reduction, urban resilience, the importance of why we include the person with disabilities. In my section, I'm going to deep dive into one of the tools that you can use to enhance the engagement of person with disabilities in disaster risk reduction. And so just before I go into the details a little bit, so let's do a bit of the recap of what we know about person with disabilities. So as Carlos also mentioned, that there is a huge population in the world that are living with some sort of disabilities. It's surprising, 16% of the population, and many of this are also facing different type of difficulties. 20% being women, 10% being children, and almost half are also living above 60 years old and living with some sort of disabilities. We also need to understand that disability is actually the evolving concept. And it's actually the interaction between the person who have impairments that are being in the environment that are filled with many barriers that prevent them from participation. So if we put into a simple diagram, the disability is when person with impairment, whether it's seeing, hearing, is physical immobilities, or even mental impairments, are living with the society with a lot of the environmental barriers, which can be physical, can be in terms of the unaccommodating policies. It could be in terms of the stigma or understanding of people as them being totally disabled. When these two things happen, this is when disability is created. This is the status of when a person being with some sort of impairments are being obstructed to be participating in community activities. So what do we want to see when we say disability inclusion in disaster risk management? We have one of the speakers who also was the person with disability himself, who joined our trainings 2 years ago. He actually expressed that if we are speaking of inclusion in disaster risk management, it's really to move from the welfare perspective to think that person with disability are seen of the object or people who need to be rescued all the time, to a totally inclusive approach where people with disability are part of the process, whether it's planning, policy, procedures. They can be consult, they can be part of operation, and even in the managerial spaces. So with this intention in mind, there comes this development of the disaster resilience scorecard for cities, the annex for the inclusion of persons with disabilities. And this scorecards were actually developed a lot by the contribution of Carlos. And the intention is for it to be the self-assessment tool for local governments to have better understanding that persons with disabilities have different needs based on their different type of disabilities, and that in order to create the meaningful participation and being able to remove the barriers, obstruction for them, we need to understand that these differentiated needs are considered fully. And by doing that, increasing the understanding, the local governments would be able to improve the design of the planning policies and be able to engage persons with disabilities in disaster risk reduction more effectively. This tool was launched in 2022, and it has been piloted in many of the cities, and currently it's available for free through this website on the screen. You can scan the QR codes as well, and it's available now in 8 languages. The structure of the scorecard it's basically a simple set of questions. There's only 19 questions within this annex, with the options of the scoring between 0, 1, 2, and 3, whereas 3 is the maximum possible score. And it structures along the 10 essential for making cities resilient, of which Sandria has already mentioned in the previous presentation. The content of the question is structured around the Convention on the Rights of Persons with Disabilities. It's aligned also very well with the intention of the Sendai framework, focusing on 2 important cross-cutting principles. 1 on meaningful participation, and 2 on accessibility. I also have seen the question in the Q&A asking, what does it mean, meaningful participation? Meaningful participation is really when you meaningfully engage a person with disabilities. You give the presence for the person with disabilities to be part of the planning process, assessment process, implementation process, evaluation process, and that they can represent the thought, that represents the need, and they're being treated with autonomy. And in such process, it can be the person with disabilities being presented in the discussion or in the process themselves, or it can be done through the Organization of Persons with Disabilities, or OPDs. These are normally the organizations that are run by the persons with disabilities and also for the person with disabilities. So they're the one that actually knows what the person with disabilities are facing with, what type of challenges they are facing with, and what kind of needs that their needs requires, and what kind of barriers that should be removed from the environment that they are facing. The second issue is accessibility. So for meaningful participation to be effective, all the barriers that create the obstruction for persons with disabilities to be engaged needs to be removed. First, it needs to be identified. Different type of person with disabilities require different solutions. Those needs to be identified and be addressed, whether it's physical, whether it's access of information, whether it's any policies or anything. And such access, when the person with disability are present, we have to treat everyone basically as a human being. Make sure that it's a safe space, and the person with disabilities can also be respected as similar to other people. Now let's have a look a little bit at the indicators there in the scorecard. So the scorecard, as I said, is structured along the 10 essential. Essential 1 is focusing on the organization, the governance system. And the question is, for example, this one, is there a designated focal point at the local government level with decision-making capacity and adequate resources to coordinate and address disability inclusion in disaster risk reduction? And you have the option to choose 0 if no, you don't have the focal points, and 1 if you have the focal points with some staffing, but maybe not enough financial resources. You can score 2 with, yes, you have sufficient staffing as a focal point, but insufficient financing, and the impact of the focal point in terms of influencing the policy and process within the local government is limited. Or you can decide to score 3 if your local government is fully constructed with the designated focal point, you have good coordination mechanism, and the focal point has a very high influence in ensuring that the person with disabilities are not left behind. So when you do the scoring, you can see if you score 3, then you're very good. If you're not scoring at the maximum 2, 1, or 0, you see the gaps of what you can improve in the future to make sure that you are meaningfully engaging with person with disability in the next planning cycle. The scorecard is available for free, and it's available in a few formats. One is in the PDF accessible designs. It's printable, and it can be used, just reading with a lot of the explanation on what each of the essential is focusing on, the type of the topics that we want to focus on in each of these essential indicators. And we also have the Excel tool that has also the pictogram analysis that you can use in the planning process within the local government DRR planning process. Here I'm going to show you some screenshots of the Excel tools. So you come in on the first page, you have a lot of the circles that you can click to go to different pages, from putting the city information to see the results, to go to each of the essentials to see the indicators, and even to reset the score and to restart doing the assessment. The Excel tool has the Excel sheet that allow you to include the profiles of the cities, and also the sections that you can include the profiles of the person with disabilities. You can provide this aggregated information about who the person with disabilities within your local governments are. There are spaces that you can also describe a little bit on the current situation of what you think person with disabilities are facing in terms of disaster risk reductions, who are the stakeholders that are engaging, who are the OPDs working within the city premise. And you also have this worksheet aligned by each of the 10 essentials that has the question. It provides the comments, explanation on what the question is asking. There is a space where you can select the score, but more importantly, there is also space for you to provide the evidence why you choose the score 0, 1, 2, or 3. And it's very important to back your answer up with some clear fact and evidence, so that the scoring is not so subjective and you are bringing it down with the facts base, and you create the evidence-based information that you can use to build up the local DR planning. There are also space where you can identify the action, that you can address the gap that you identified, who will be responsible, and also the time scale of the actions. So by the end of the scorecard exercise, you should be able to identify at least 19 gaps from the 19 indicators, and those can be very useful for you to use in the planning stage. In the Excel file, it shows also the final results of the scoring of the cities comparing across.
You're frozen.
We'll see more of this in the example that we'll be hearing from the two cities that we'll be presenting after my presentation. You can also download the reports for use also in your process. Now, what I would like to do in the next maybe 5 minutes is for you to grab your phone, or you can log on to the website, slido.com, because I'm gonna ask you to join me in doing some of the exercise. So please do scan this QR code, or you type slido.com on your web browser. You'll be asked to put the keywords, just type UNDRR in there. And we'll be starting to do some indicator exercise together. So I'll give you just a little time for you to log in, just scan the QR code. And we can see the number of people joining the exercise on the top right-hand corner of the exercise. So we have, I think, 1,000 participants in a training. So I hope that we have many people joining here. Very good. So I have a number of people here. So this is the same question as what I was showing earlier. Whether your local governments have the designated focal point that have the capacity and responsibilities to coordinate it on the disability inclusion in DRR issue. If no focal point, score 0. If you have focal points, but probably not enough staffing and finance, then you can score 1. If you have a focal point with sufficient human resource, but limited finance and limited impact, then you score 2. If you have the super robust team that can coordinate for disability inclusion agenda in your locality, you can score 3. Okay. So imagine if you are representing your cities, you come with different opinions. So you will see variety of the scoring. And in this case, we can see the majority of you, more than almost 300 people are saying that most of your local governments have some focal points, but maybe the focal point is not yet with good staffing or financial resources and very little impact in terms of sensitizing these issues. So this is a clear gap that you can see from your local government, and perhaps you can think of some actions of how you can actually improve this, whether it's sensitizing your local governments to ensure that there is a dedicated focal point, whether there's a restructuring of the local governments to make sure that there are more funding or staffing being provided to this department, for example. Okay, that's good. So let's move to the next question. We have like almost 400 people joining. Next question is coming from Essential 6, which is looking at the societal capacity. So the question is asking, are communication materials and information on risk and resilience available in accessible and easily understandable formats to ensure the inclusion of persons with disabilities? Right, so if you have information in all format available, you score 3. If you have most information available, but some still lack of the design of this communication materials and messages with the involvement of persons with disabilities or their organizations, you can score 2. If you have limited information available and those of the information are not normally accessible, then you can score 1. And if you have no information or communication materials targeting persons with disabilities at all, then you can score 0. Sorry. Right. You can see again, majority of you are scoring 1. Limited information materials are available and in limited accessibility format. So this is another clear gap that maybe this is something that your local governments or the OPDs or the people working to support the inclusions can also work with your local governments after this. So next question is the last question for the exercise. It's from Essential 9, focusing on response preparedness. The question is asking, does the local government conduct annual drills or simulation exercise that include persons with disabilities and their organizations? 0 if there are no exercises that include person with disability. Oh wow, there's a majority of you who answer it right now. One, if you have partial exercise with limited scenarios, limited involvement of person with disabilities. Two, if you have annual and regular drills, sometimes involving OPDs, but only partially addressing some needs of the person with disabilities. You score 3 if you have realistic drill co-led by the person with disabilities and address all of the specific needs of the persons with disabilities. I'm still happy that there are at least 7% who have scored 3. So meaning that we have very good examples from somewhere out there. But strikingly, majority of you who are participating in this training have revealed that there are no exercises that include person with disabilities. Right. So I'll just end with the next 2 slides, a couple of slides that we have the snapshot of the study of the pilot's use of the scorecard that shows that across the 10 essentials, most of the score is still far below half of the scorecard scores, with essential 4, pursue resilience urban development, being the highest, which is still only 1.23. And if we look at the indicators per se, only the building code and standards are scoring above 2. Majority of the rest of the indicator is showing less than 1. So what this shows is that there are still a lot of things that needs to be addressed from the absence of the disaggregated data. People don't know who the person with disabilities are in the cities. There are limited knowledge of DRR among the policymaker, about the person with disabilities, and also how to engage person with disabilities among the policymakers. Some of the person with disabilities also have been excluded in a lot of the activities, so they also don't know how they can proactively be engaged with the process, and thereby limit the participation, and also absence of the designated focal points are the key gaps that we found. Maybe one last important note is that this scorecard is not for comparing cities, but it's for the cities to capture well what you have done good and to discover more of what you can improve further. And please make sure that you use the scorecard assessment results for the planning and to continue the improvement, and make sure that this process is inclusive. You include everyone who are representing the cities together, especially ensuring that person with disabilities are part of the exercise in the assessment, and that the facility is also accessible. So I leave you with that, because we will be hearing more detailed examples from the cities that will be presenting after me. Thank you.
Thank you, Mai. There are questions in the Q&A, and we can have a look at that and answer them through typing, because now it's time to move on to the next speaker, who is Bianca D. Perez from Quezon City, and she's going to give us an example of a city actually implementing disability inclusion in their DRR strategy. So Bianca, the screen is yours.
Good day to everyone. I hope that I can be heard clearly. I can be heard clearly across the board. All right, so let me just share my screen. All right, so let me present to you an example of the application of the Making Cities Resilient Scorecard, particularly the addendum on disability inclusive disaster risk reduction. So I am Bianca Perez, the head of the Disaster Risk Reduction and Management Office for Quezon City, Philippines. So Quezon City, for those who are not familiar yet, it's in the Philippines and it is located in the National Capital Region. Quezon City is the largest city in the country, and in terms of the population, so currently we are at over 3 million in population, and our mayor, Mayor Joy Belmonte, envisions for the city to be the green lung of the region of Metro Manila, to be the knowledge industry capital of the Philippines, and to be the center of health and wellness of Southeast Asia. So Quezon City, with over 3 million population, are divided into 6 districts. And further on, divided into the smallest administrative boundary called the barangay. So the barangays in Quezon City are over 142. So to provide you an overview of the situation of persons with disability in Quezon City, we have recorded or registered around 83,784 persons with disability as of March this year. So the way that we are able to register and record persons with disability is through the issuance of a residence identification card, which we call a Q citizen card. So if you have this identification card, you are able to you are able to access services from the city government, and it is also a way for us to determine to assess the various sectors of our city population, which includes the persons with disability. So across the city districts, we are now able to determine how many PWDs we have across all districts. So just to provide you the breakdown of the over 80,000 persons with disability in our city, we have divided them according to their type of disability. And these are the disabilities recognized by the city that the national law that if you have these disabilities, you may be able to avail particular benefits and access to services. So as you can see here in the breakdown, those with physical disabilities take the largest portion, or are the most populous among the sector of PWDs in the city. So they comprise of over 36% of the PWD population in the city, and they are the second in rank in terms of population are those with psychosocial disability, which numbers to around 15,000 individuals. The third are those who have been diagnosed with cancer. And the other types of disability, which are enumerated here, are those who are deaf or hard of hearing, those who have been diagnosed with intellectual disability, learning disability, mental disability, those with rare diseases, speech and language impairment, and visual disability. So this is very important for the city government to determine the breakdown of the type of disabilities of our PWDs, because with disaggregated data, we are now able to identify specific interventions that we can implement, we can design for this particular sector of the population. And not only that, we have divided or we have determined their types of disability, we are also able to determine according to their division according to sex, wherein majority are males, but just closely behind are females. We are also able to determine the age range of our PWDs, wherein we determine that most of them belong to the workforce or the labor workforce of our city. So just looking at this situation alone, we can see that the more than half of our persons with disabilities are part of our workforce, and it may be and we can develop interventions particular to reducing barriers to access to employment for our PWDs, basically because they comprise basically because most of our PWDs comprise of the workforce of the population. And now, diving deeper into the disaggregated data, we now have the opportunity to map the persons with disability according to the natural hazards that the city is exposed to. So, in partnership with the focal person for disability affairs in Quezon City, we are able to make a map wherein we have superimposed the hazards, particularly for flooding and for earthquake, eh, with the data on the population for the persons with disability. So as you can see here in the map, um, since we have the data of the population, we have overlaid it into the exposure data for flooding. So the darker the color there is on this map means there is more or there is a higher number of persons with disability in that particular barangay. And if you can notice the blue shades in the map, that shows the flood susceptibility coverage of um of our city. So if these barangays have flood hazards, this is one consideration that we have to make, particularly on prioritizing disaster risk management interventions according to area. As you can also see, there is the purple line on the right side of the map, which depicts the West Valley Fault that transects the city. So the West Valley Fault is a fault line that threatens to move and may may affect a large part of the population of the city because of ground shaking and earthquake. And now, since we are now able to plot the areas where the persons with disability live or where they are congested, we are now able to prioritize our services, particularly for disaster response or disaster preparedness in these areas, which will be with heavily affected on of earthquake when that happens. All right. So moving forward, since we now have this data, in November 2023, we applied the scorecard for the city with the Disability Inclusive Disaster Resilience Scorecard for the city, and this help us to determine where the particular gaps are we have in terms of developing interventions and programs. So as discussed earlier by Mai, there are 10 essentials um, from this scorecard. And from here, we have identified particular areas where we can focus to build on our inclusion policies. So in particular, there are gaps in terms of essential three, inclusion of persons with disabilities in financial inclusion, gaps in institutional capacities, gaps in infrastructure resilience, and gaps of inclusion and recovery or building back better. So this scorecard, it's a structured approach for us. With a city as big as Quezon City, it is very important that we are able to prioritize where to build our strengths and which shortcomings or gaps to um, to address. And because of the scorecard, we are able to determine that this four essentials needs to be addressed to cover significant gaps for our policies, for our inclusion policies. So we are able to determine that in terms of financial capacity, we have to build more investments or make sure that there is to build on access for financial mechanisms for our persons with disability. We have also determined that in terms of institutions that in terms of public services that are offered to our persons with disability and training and capacities, there are significant gaps that we still have to build in. That same goes also for infrastructure resilience, that there are possible barriers still that exist in the infrastructure of the city that we really need to reduce to increase access for our PWD sector in our population. And in terms of when a disaster happens, we have to develop more programs that would include the persons with disabilities and their needs in our building back better. So it is important that when you apply the scorecard, it is not just the city government, or it's not just the government agencies or personnel who are answering the scorecard, but it is really important to have the organized members of the persons with disability sector to also join you, and also to have all levels of governance to participate as well in the exercise. So for example, the national government is also there because in the Philippines they are part of um, policy making for local government units. It is also important that we have members of the community leaders who also participate in the application of the scorecard, so that uh, we also know what is happening on the ground, and it's not just a top to bottom approach. And it's really important, um, and so that our policies would be more intuitive, not just to cater to the concerns of our um, persons with disability sector, but also to the overall communities that the policies will affect. So in doing so, after we apply the scorecard, we determine that our enabling environment is robust because we have the Public Act 10121. It's a national law that determines the the DRM framework for the Philippines. And while it does not explicitly say that there must be specific programs for persons with disability, part of its policy statement is that there is no one should be left behind in all DRM activities. And in doing so, the city government innovated upon this framework. And when we created our own local special body to develop our DRM programs, we made sure that the focal for persons with disability affairs is included in our local special body membership. And that enables us that in the planning stage, there is a focal person that can raise and can include the needs of this part of this sector to our DRM programs. We are After the application of the scorecard in 2023, we are also able to increase our investments. As you've seen earlier, one of the results of the application of the scorecard resulted to a huge gap in financial capacity. So because of that result, we are now able to focus our attention on providing and on making sure that there are investments for the persons with disability for disaster risk reduction. And through the years, from 2024 and up to current, there is a continuous increase for investments to programs dedicated for disaster preparedness for the persons with disability, and not just for PWD as whole, but particularly for children with disabilities. So these are just samples of the programs that we have developed, like the master listing of our and updating of children with disabilities per community, the conduct of carrying out implementation of trainings, provision of assistive devices, um, trainings for carers or for the family of persons with disabilities, publication of children's book that that includes the needs of children with disabilities, and more and other DRM materials that that should also be accessible to those who are differently able. We have also identified programs such as protection mechanisms or abuse awareness trainings for children with disabilities to protect them against violence during disasters or in a post-disaster setting. We have also determined training programs for those who are for the disabled themselves and for the responders who would be rescuing persons with disabilities or helping to rescue um, children with disabilities during disasters or during flooding. So as a result, these are the number of beneficiaries that we've had since 2023. It's not just the organized PWD sector or the communities, but we also include members of the community, special education teachers, community members or barangay officials, and of course, responders and frontliners. So we have capacitated the part of the society who also support the PWDs. So it's important to build the societal awareness for the needs, special needs of our PWD, so that all of us, the communities, can help together with the government to respond to the needs or to reduce the barriers for the PWDs to be able to recover quickly after a disaster. We are also able to determine the profile of those who we have capacitated. This is in order for us to make sure that our interventions are still equitable, that it's not just as a whole, as a one size fits all solution, but it is also catered to the different types of disability that we have identified. So in this aspect, since 2023, really a bulk of it have been administered to the carers or the parents of children with disabilities, and to the members of the community who can assess the sector, the PWD sector. And then we have also provided assistive devices for our PWDs with prioritization for those who are in hazard-prone areas. So this is so that they can hear, they can also access the various early warning systems that we have established for disasters within their areas. We are also continuously auditing evacuation areas or the shelters that we use in disasters. Although this is because the scorecard resulted to a really low score in infrastructure resilience. And part of it is that we now realize that our camps where displaced population stays is not really accessible. And so now we are now making efforts to audit or to assess all the evacuation centers that are being used by the city, to make sure that those who are physically impaired or those or different types of disabilities have access or are able to move freely through these facilities. And also, since we determined that there is also a real low score for recovery programs, we enjoined now our PWD sector for recovery programs that we have in DRRM, such as enabling our PWD sector to join us in urban farming and making sure that our trash can be converted to cash or to other benefits. And we are now enjoining them, since a large part of them are part of the workforce. We are now also enjoining them in our community cleanups and other programs for our environment. So we have actually enlisted among those who we call as eco warriors or deputized as eco warriors, 4,500 persons with disability. Now, these are the continued challenges that we have also determined because of the application, the scorecard. We now saw that, of course, there is now limited number of recipients due to the high cost of assisted devices. It is really difficult to have a comprehensive registry for PWDs. There is still limited information on DRRM in accessible formats for all the types of disability, and that goes the same for early warning system. And so how do we move forward with this? So we have to continue to sustain the financial investments for DRM budget and secure access for other international programs. Anyway, we have this data, we have the justification and basis for which we should focus in. We have to continue implementing inclusive preparedness training modules that it is accessible to not just those to the general part of the population, but it has to be accessible and understandable to the differently able. We have to provide technical support for our community so that they are empowered to plan better. And it's not just at the city government that we are able to design and develop these interventions, but the community themselves, they can also um, capacitate themselves and they are empowered to also implement programs that are inclusive. We are to also strengthen the engagement with of the community through organizations of PWDs to know their specific needs and to have more intuitive policies, to continue the infrastructure resilience through continuous auditing and assessment of our infrastructure. We have to make sure that our early warning systems and alert systems are accessible to those who have different disabilities. We do not just use sirens, but we also use different methods to access the whole of the population. And of course, we have to continue to build partnership and linkages, just like the partnership we have with UNDRR, so that we are able to apply this scorecard. So these are our commitments on moving forward to make sure that we have a disability inclusive disaster risk reduction in Quezon City. So that is my presentation, and thank you. These are my contact details for if you have any further questions. Maraming salamat po.
Thank you, Bianca. There are some questions in the Q&A. If you can just have a look at them and type out some of the answers. And so with this, thank you very much. But there are also a lot of congratulatory messages in the chat and in the Q&A. So congratulations to Quezon City for being one of a best practice that other countries in the world can follow. And there are some questions about, are you sharing this experience with other countries and cities in the world? And if you aren't, then you should. And we'll definitely try to give you opportunities. But as a city by yourself, you should also try to publicize as much as you can these experiences, because these are very valuable. Thank you again. So with this, let us go to the next speaker, Maria Elena Opazo, Director of Disaster Management from Pudahuel Municipality in Chile. She'll be speaking in Spanish, and please go to the globe and select the language in which you want the interpretation. So Maria, the screen is yours. And you have about 10, 15 minutes.
Good morning, good afternoon, as appropriate. It is a pleasure for us to be here. I will share the experience of Pudahuel, which is a city located in central Chile, a medium-sized city. According to the last census in 2017, we had a projected population of 230,000 inhabitants, but the current projection is already close to 300,000. We have exponential urban growth, and we are projected to reach 1,200,000 people by 2030 due to large urban megaprojects that will be carried out in the municipality. Therefore, we are quite concerned about addressing the threats posed by this urbanization and climate change in terms of disaster risk reduction, ensuring it is absolutely inclusive. Next slide, please. In Pudahuel, we understand that the inclusion of people with disabilities is fundamental to carrying out truly comprehensive risk management. We have been working very closely in a general and multi-sectoral way with a territorial approach, viewing the territory in an integrated manner so that these needs are included in our emergency plans and the urban planning being carried out by the municipality. We follow important frameworks such as the Sendai Framework and human rights, which are our objectives. Every risk management action we take must reflect these principles. When we applied the Disability Inclusion Scorecard tool, it showed that we were at quite a low level. However, since its implementation, we have been able to strengthen our approach and adopt the necessary adjustments to close the gaps that were leaving an important part of our community behind. To address this, we have conducted surveys and implemented several measures. Including disability considerations in our plans has been crucial. It allowed us to clearly see progress, identify areas for improvement, and develop community emergency plans. However, this has been particularly challenging because the data on people with disabilities is not entirely clear. Since we do not yet have an updated census, we will only be able to obtain more concrete data in the near future. Additionally, it became evident that there is a need for adequate funding and more active participation of people with disabilities in decision-making. These findings led us to create disaster risk management committees that include people with disabilities, meeting at least 4 times a year to take measures and conduct simulations. Among the main gaps we identified, there are 3 key issues. First is insufficient financial resources to strengthen our early warning systems and evacuation projects. Second is the complexity of addressing disabilities. As Carlos Kaiser, one of our indispensable allies, mentioned, disability cannot be viewed from a single perspective. And third is the challenge of considering different types of disabilities and ensuring that all needs are met.
All types of disability. And also the intersectionality between being a woman with disability, being an older person with disability, or a child with disability. It's a very complex scenario. And when you tackle this, there are many corners and considerations to take into account. When do we start? We start with the community, with a supportive network that has allowed us to include this in our plans. Another gap we've identified is the lack of auditing processes in this building of measures that can reduce the gaps for people with disabilities. And number 3 in this gap list is the need to consolidate databases and improve the coordination among the different institutions, considering multisectoriality and the other factors that intervene. All of this is relevant when dealing with risk management and inclusion.
To face all these challenges, we have adopted some points of action, which for us are the basis on which we work. We have to do with improving communication and the dissemination of these emergency plans. We don't need to have more meetings. We need to work with the community. We have to work on this not only with the PWD community, we have to integrate them into the process with the rest of the community so that we can insert this population into the process, so that we can work together in collaboration, so that we can understand the territory and so that we can have integration. We need to also implement early warning systems which take into account different types of disabilities. This is a very complex issue, and we need the support of the community network in order for this to work. This is something that we saw in practice. And then we need to have people with persons with disabilities to facilitate this process. Our territory is large. It's about 200 square kilometers, and we have a variety of threats. We don't have tsunamis or hurricanes, but we have had other types of threats. We've had dangerous substances, we've experienced floods, droughts. So we need to apply this to our territory. That's extremely important. Operationally, we have implemented some very concrete activities in order to strengthen community preparedness, such as drills and trainings for people with disability and their carers. And we've also tried to involve key stakeholders, including all organizations that represent PWDs. And finally, we also have developed some community plans focusing on emergencies that guarantee the active participation of these groups. And this is the foundation of the work that we have carried out. What recommendations do we have? We were the first ones to apply this, and so we were the first ones to realize where our weak points lay. So we would like to share that governance and political will that has been mentioned already today is essential in order to carry out these necessary changes. Why? Because the measures to reduce or manage risk in political terms are not always immediate. And the political authorities or leaders are in power for short periods, maybe from 4 to 6 years. And the important thing is that we can take high impact immediate measures. So what do? We include this in development. So if we take measures, for example, to do with infrastructure, community measures, we ensure that they have this development plan and vision, that we can understand that these measures have to be implemented immediately. Because I have a population in which one single event could result in great loss and can really show extreme levels of vulnerability. So as a leader, as an authority, I will also lose out if I don't implement these things immediately. My image will suffer. And so this is a work in the area of governance, which is very delicate. So in order to do this, we have to have strategic partnerships with local governments, with civil society, with the private sector. So this joint work means that we positively are able to work together, and it's key to protect the vulnerabilities in these sectors and to ensure accessibility. So these are the points that I can share from an inclusive and resilient point of view in terms of how to deal with disasters. So our commitment, our future commitment, is very wide. We want to develop a local residence plan that incorporates all of these lessons learned, and we want to take specific action points. And this is a plan we have been developing alongside others with local authorities, with the government, the local government. We want to ensure that inclusion is a key point in the development of our urban and risk management policies. Interagency coordination and citizen participation are keys in this process. And finally, to end, I would like to emphasize that Paduel's experience in inclusion of persons with disabilities has involved a continual learning process and commitment, and it's been a work that we have carried out in cooperation with others. It's not something that we have done alone. It's very community-based. It has its roots in the community. We can do nothing without people. Everything has to be done with others, as Carlos was saying. And so that's something that we learned. It is complex, but it's possible. Thank you very much. And I have left my contact details on the screen if anyone would like to contact me and ask any questions.
Thank you so much. There are a number of questions in the Q&A, so you can have a look at some of them and maybe type out the answer. Or you have shared your contact details so the people can connect with you for more information. But these two examples from the cities are for all the participants to understand that there are solutions available, and you just have to be willing to implement them, and then the solutions are there. So now let us move to the next part. I hand over to my colleague Mai. We are going to do a quiz, and this is part of this session. So please take out your mobile phones and be ready for a very, very quick quiz before we end the session. So Mai, over to you.
Thank you, Sanjaya. Let me try to put the quiz up. And again, please take your mobile phone out. Again, we're going to be using Slido. I hope you can all hear me fine. So please pick up your phone again and go to Slido. We're going to do a short quiz, only 5 questions. And you have to answer accurately and also fast because we have the leaderboard showing on the screen. So just scan this QR code. This time, just plug in the code UNDRR2 in there. I'll start to see your names on this. So yeah, so there are a lot of people coming in. So let's wait a little bit and I'll bring you to the first question. So there are 5 questions, a mixture. Some of questions is yes and no, some is a multiple choice, some is true or false. So let's get ready. Okay, we have fairly 300 people. So I'm going to move to the first questions. Please get ready. First question is true or false? Persons with disability often have different and uneven levels of resilience and capacity to recover from the impact of disasters. True or false? In the count of 3, 2, 1, I'm going to show you the answer. True. The correct answer is true. Yes, the person with disability has different level of impact and different level of resilience capacity and have limited, less chance or more difficulty to recover from the impact of disaster. You got it correctly, 93%. So we have more than 500 people joining. So let's move. We have the leaderboard here. You just see if your name's on there. We're going to move to the second question. Second question is again, true or false? Disability is a term used to describe people with impairments and inability. They are the people who will always need help and support. True or false? In the count of 3, 2, 1. The answer is actually false. Disability is an evolving term that people with impairment is facing the barrier, so they are unable to participate. It doesn't mean that they are not capable. They doesn't need help all the time. If we remove the barriers, they will always be able to act and meaningfully participate in the activities. So this question is a bit tricky, but the answer is false. So let's go to the leaderboard. Now we have some changes in the leaderboard here. Let's go to number 3, question 3. What are the key principles emphasized in the scorecard annex for the inclusion of persons with disabilities? meaningful participation, accessibility, all of the above, or none of the above. 3, 2, 1. Yes, most of you got it correctly. Is both the meaningful participation and accessibilities. You have to make sure that persons with disabilities are engaged. They have the respect, have the dignity, can represent the needs, and all the barriers for them to participate are removed. Very good. So we're going to move now. Again, some changes in the leaderboard. We'll go to the fourth questions now. Fourth question is a multiple choice. Which of the following is not a benefit of using the scorecard annex for the inclusion of persons with disabilities? Recognizing city achievement in disability inclusion, comparing progress with other cities, identifying key gaps and issues for disability inclusive DRR, or engaging stakeholders and gaining support. Let's see the answer. Very good. 70% of you answer correctly. The scorecard intention is not for you to compare progress against other cities, but it's used to compare yourself over time and be able to help you to recognize what gaps you have, be able to recognize your achievement, identify what actions you should do to address the gaps, and be able to use that to create dialogues to engage with different stakeholders. Now let's see, a little bit change in the leaderboard here, and then we'll go into the last question. Last question is asking a multiple choice again. What can a city do to ensure persons with disabilities are not left behind? Understand the diverse needs of persons with disabilities. Appoint a city focal points for disability inclusion. Engage persons with disabilities and their organizations in DRR planning, or all of the above. Let's go see the answer. Yes, almost 90% got it correctly. Yes, it's all of the above. The cities can actually improve the inclusion of persons with disabilities by doing many actions, from understanding the different needs, appointing focal points to make sure that the disability inclusion agenda is high in the priorities of the cities. And you need to engage persons with disability meaningfully to make sure that your DRR policy and practice are inclusive. So final scoreboard, big congratulations to those who made it up on the board. And it seems the hardest question is on the disability term. So make sure that you understand that disability is an evolving concept. It doesn't mean that the person is not capable, but it's just because they are facing with some barriers that they do not have the equal participation to others. So hopefully that you get understand this from the training sessions, and hopefully that we can create the meaningful participation in inclusive society together. Over to you, Sanjaya.
Okay, thank you so much, Mai, and thank you to all the participants for actively participating, not only in the quiz, but also a lot of questions, many which have been answered, but many remain unanswered. Hopefully next time. So please remember, you have to participate in all 3 sessions and the survey to receive the certificate. The next session is on the 19th of March at the same time. Yeah, you can see it here on the screen, and it is about the older persons and disability inclusive urban health emergencies and disaster risk management, led by the Pan American Health Organization and the World Health Organization. So we will see you again on the 19th of March at the same time. And these are the speakers you can see who will be sharing their experiences with you. All course materials are on the link which just popped up. And with this, we end today's session. So thank you again for very active participation.
Thank you.